how are social systems related to health? Consider, we are constantly interacting with our surroundings, including social systems composed of interactions we have with other people, institutions, communities, and policies. Efforts aimed at improving population health require an understanding of the complex relationships between social systems and health. Social systems influence behavior in several different ways. First, by shaping norms. In this situation, certain behaviors have become generally accepted among certain social groups. An attitude of, quote, everyone else is doing it, can have a strong influence on an individual's decision to partake in an activity. For example, in some communities, it is rare for individuals to wear a helmet while biking. So an individual who has always used a bicycle helmet in the past may decide to forego it because nobody else is wearing one in that community. A second factor is the enforcement patterns of social control. So having rules and regulations in place creates structure for society, which can affect health. For example, a community could have a curfew in place, requiring teenagers to be off the street by 9 p.m. unless accompanied by an adult. This is aimed at helping to prevent violence. Providing opportunities to encourage and engage in healthy behaviors. The opportunities, or lack thereof, in our surroundings can have a strong influence on our health. For example, having access to a community pool can encourage individuals to learn to swim, thus preventing drowning, while also serving as a form of physical exercise and social cohesion. This is a form of influence based upon our surroundings. Another form of influence is encouraging healthy behaviors as a coping mechanism, reducing or producing stress, for which certain behaviors may be an effective coping strategy, at least in the short term. So let me give you an example. College students often go through stressful periods throughout their academic careers, particularly around exam time. While some students may decide to cope by blowing off steam through the form of binge drinking, others may choose to go on a run or engage with friends, each choice having an effect on health. Within our social structures, socioeconomic status, culture, and religion are three key components of the social system having a strong relationship with health. Broad social influences can affect an individual's response to disease. Let's start by looking at how socioeconomic status can influence health. Beginning in the 1800s, social scientists developed the concept of socioeconomic status. They also developed elaborate systems to operationalize the definition of socioeconomic status so that they could classify individuals. In the United States, the definition has generally included measures that are primarily economic, including a family's income, educational level, or your parents' educational level, and your professional status or your parents' professional status. We understand many, but not all, of the ways that socioeconomic factors affect health. Greater economic wealth usually implies greater access to healthier living conditions, improved sanitation, less crowding, greater access to health care, and safer methods for cooking and eating are all strongly associated with higher economic status in developed as well as in developing countries. All of these factors also relate to good health. So what are the ways that culture may affect health? Culture is related to behavior. There are social practices that may put individuals and groups at an increased or reduced risk. So some examples. There are food preferences. Some people are vegetarian, some are vegan, some follow a Mediterranean diet. We have different cooking methods. Some countries have different cultural practices, such as a history of binding feet in China, and the role of exercise. Culture is also related to symptoms and the response to symptoms, such as the level of urgency to recognize symptoms, seek care, and communicate symptoms. An example would be cultural differences in seeking care, and self-medication. Also, social, family, and work structures that provide varying degrees of social support. If you have a low degree of social support for seeking out medical care, chances are there's a less likelihood you'll do it. Culture is also related to the types of interventions that are acceptable. So, for example, there are variations in the degree of acceptance of traditional Western medicine, including reliance on self-help and traditional healers. Likewise, there's variations in the degree of acceptance of traditional Eastern medicines, things like acupuncture and Tai Chi. Culture is also related to the response to disease and to interventions. There are cultural differences in follow-up, adherence to treatment, and acceptance of adverse outcomes. All of these can have influence on a population's health. Let's now think about some of the ways that religion might affect health. First, there are social practices that might put individuals at an increased or decreased risk for developing a disease or being injured. Things like the use of contraception or alcohol consumption varies differently across religions. Religion may also affect the response to symptoms. For example, Christian Scientists reject medical care altogether. Religion may affect the types of acceptable interventions. For example, there are different opinions within religions and different attitudes towards abortion or stem cell research. Religion may also affect our response to a disease. So, for example, the role of prayer as an intervention. These are all ways that religion may affect health. So what are the social determinants of health? These are the conditions in which people are born, grow up, live, learn, work, play, worship, and age, as well as the systems put into place to deal with illness that affect health and the quality of life. They are shaped by a wider set of forces, including economics, social policy, and politics. On the next page of this module, you will find a short video that reviews the social determinants of health. Please take the time to view it.